So thank you again for tuning in and taking time out of your morning to be with us today. My name is Ariana Erickson, and I am a student within the Accelerated Masters of Public Administration program here at CU Denver. And I'm also a member of the Social Equity Planning Committee. So we're really excited to have you here for part 2 of our social equity series. I am delighted to introduce our panelists, Jailan Adly, the Managing Director of RefuSHE, and Geoffrey Thige, the CEO of RefuSHE. Jailan is based in Denver, or Chicago, soon to be Denver, and has spent her career forging mutually beneficial partnerships between diverse stakeholders from the private, public, and social sectors. She first joined RefuSHE as a US board member before stepping in to lead an operational turnaround in 2018. And Geoffrey Thige is based in Nairobi, Kenya. So thank you for taking time out of your evening. He's 10 hours ahead of us. And he has over 20 years of leadership and professional experience working within the international NGO sector, including leading operations at Opportunity International and Vision Fund Kenya. Both Geoffrey and Jailan will be presenting a bit on RefuSHE and the organization's efforts to decolonize philanthropy. Then it will be followed by a Q&A led by our moderator, Dr. Pamela Medina. She is an assistant professor of public administration and nonprofit management at California State University. Dr. Medina is also a former senior instructor at CU School of Public Affairs, as well as a contributor to this book, Achieving Social Equity from Problems to Solutions, which is really the framework that our planning committee uses when we plan and host events like this. So thank you again. I'll let Geoffrey kick us off with a brief presentation on RefuSHE.
Thank you. Thank you very much, Ariana. It's really a pleasure to be on this webinar. I want to thank the social equity team for giving us this opportunity. So my name is Geoffrey Thige. I'm the CEO of RefuSHE. I have a great honor of leading, waking up every morning to work with a wonderful organization that which I call a dream builder. And this is an organization that supports refugees. So you'll be hearing a lot about refugees this morning, your morning. So there's been a crisis globally, and you may have heard about it. There are basically about 70.8 million people around the world who have been forced to leave their homes due to conflict and persecution. The refugee problem is therefore a worldwide problem. Among them, nearly 30 million are refugees. Over half of this number are under the age of 18, and a majority of them are women and children. In context, in Kenya, we have about close to 504,000 refugees living in Kenya. And then 77% are women and children. So a lot of them, the Kenyan government has an encampment policy. So as you can see from the slides, there's shaded areas where the government has confined refugees to live in camps, but there's still a significant portion of them who are living in the urban areas. And basically 70 to 80% of those ones are women and children who have fled conflict from the Greater Lakes region in Africa. So a bit about the context about the legal framework. In Kenya, Kenya abides to the Constitution of Kenya 2010, which governs basically the rights across the board for Kenyans and also for the refugees. It has also subscribed to the 1951 UN Convention and the 1969 Organization for African Union Convention around the refugee protection. And it's amongst the few countries in Africa that has specifically enacted a Refugee Act, which was done in the year 2006, that has given refugees a little bit of format in a way they can be recognized in the country. There's also, Kenya did an upgrade of that on the Kenya Citizenship and Immigration Act of 2011. But basically, any refugee needs to have a pass to be able to get into formal work or for movement within the country. So basically, our vision is that we believe every refugee girl or woman and child deserves a life of dignity with equal access to safety, education, and economic prosperity. And our mission is basically to protect, educate, and empower orphaned, unaccompanied, and separated refugee girls and young women to build healthier and more resilient futures for themselves and their children. So why the concern about refugee girls and young women? Why are they amongst the most vulnerable? And basically is that refugee girls and young women, they are the first to be trafficked for sex or child labor, the first to be exploited as tools of war, and the first to lose their childhoods. They are the last to be fed in the family, the last to be enrolled in school, and too often the last to be valued. And that's the status about having 1 to 4 participants or girls whom we serve having a child. So we are talking about a girl who is basically around 13 to 14 years having a baby or having a small baby to look after. And that's why for us as an organization, if we need to address the issues about refugees, then this becomes at the very core of our work. So how do they come into the country of Kenya? Many of them, when war breaks out, and it could be breaking out in any country around East Africa region, the children and the young girls are separated from their parents. And when violence is prevalent, then the options that many of these young children or young girls end up is being either forced into early pregnancy or into early marriages. And this interrupts their education process and causes them to flee from that kind of violent situation. Now, when they cross over the borders into a host country like Kenya, they face certain challenges. First, they have difficulty in obtaining documentation because they have fled their countries with little or no documents or clothing or personal things. Then they are taking care of children and younger siblings, because when war breaks out, then the men go out fighting, and the first victims to be killed are the men and the women. So the younger children then become caregivers. Then they come into a host country where there's also xenophobia, because then the host country feels that refugees are taking their places in either in the competitive job market. And across the world, there's been a declining global resettlement rates, which becomes a challenge for refugees. So in RefuSHE, finally, when this girl has traversed many borders, either by hiking lifts or walking for many days, they are introduced to RefuSHE either through governments, the police department, the social welfare department, embassies, the Commission for Refugee Affairs, and other partner organizations like embassies. They will refer these young children or these young women to RefuSHE, where they are able to access safe shelter and medical attention, because by the time they get to us, either they have suffered sexual gender-based violence, they have been violated along their flight path, and they need medical assistance. They need psychosocial care because they have seen a lot of violence along their flight path. Their education, as I said, was interrupted, or they're completely illiterate, and they need childcare, and they need vocational training. So RefuSHE has basically, we pride ourselves of having a three-pronged approach. First, we believe in the rights of refugees, that all individuals and communities need to be supported and to participate in their welfare. Secondly, we know that we cannot address the refugee issue without having to address the trauma that these children have faced. And without that trauma healing, they will not be able to function optimally. And lastly, as I mentioned, we are a girl-centered organization. So we have a holistic model. We provide individualized attention and support for every girl. And we listen to learn about each girl's individual journey, because we don't take it that all the girls have faced similar situations. Each girl has a different coping mechanism from the trauma they have gone through, and we assess both their physical and emotional needs before addressing their needs. So key amongst our initiatives is that safety and security is key. Some of the children or young women have fled their countries because either their parents were government officials, and when a militia group attacked their village, they killed their parents. And these children have safety and security concerns. So we as RefuSHE have what we call a safe house or a shelter where we're able to keep them secure. Those that have been violated either through sexual gender-based violence, we give them a place where a safe space where they can be able to recover, and they meet a community of friends and peers to provide mutual support. So in this particular place, they get medical attention and they're able to recover before we look for a transition plan for them. Then we also do provide protection services in terms of accessing to counseling, which is psychosocial counseling. We provide nursing care, health education, and hygiene. These are children who have never been trained on issues to do with sanitation, and their life basically as children has been interrupted. We also have yoga and wellness activities, things that help alleviate the stress and the issues that they've carried. We provide them with an education platform where we are able to enroll the girls in an accelerated primary education school where they're able to get their basic education. And also we add it with life skills training, reproductive health, women's rights, and the rights around refugee affairs. So we have a school that does disseminate this education. As I mentioned, out of 4 of the girls has a child or a small baby. Now, for the mother to be able to concentrate in education, then they need to be able to know that their children are in a safe space. So we have an early childhood support system where we have caregivers who looked after babies. Young children between 5 to 6 receive their education, and older children are able to attend primary school so that their mothers can be able to attend to class. We also are strong about providing vocational training, because not all of them are keen on education per se, but there are some that are very gifted with making textiles. They are interested in learning how to manage the financial literacy and small businesses that they would want to do when they exit from the program of RefuSHE. So I want to speak something I'm passionate about, is that as the girls finish their education and they have gone into vocational training, we have an organization or a piece of organization called the Artisan Collective, where these girls handmake tie and dye scarves, which we are able to sell. And each and every hand dyed scarf is made specifically by a girl, a refugee girl, as part of their trauma healing process. And this is a 2-year apprenticeship program that equips girls with additional specialized skills. And we're able to give them a monthly stipend, which they will never have earned because of challenges in documentation. They're able to get food on their tables, and they're able to produce scarves that we are able to sell internationally to be able to support the work of RefuSHE and many more girls in our program. We also do protection and advocacy. We facilitate registration to obtain, as I said, the girls don't have documentations. They are basically what you call illegal immigrants. We facilitate registration with the various relevant government organizations. We also do a lot of advocacy work with partners, and also influencing the government and the non-governmental sector and policy players on the rights and challenges of young women, refugees in our country. And our focus is basically on refugee protection, child protection, and the rights of women and girls. I will pass it on to my colleague, Jailan, who will take us through the next presentation. Thank you.
Thanks so much, Geoffrey. Thank you everyone for having us. So as Geoffrey kind of explained, our services are incredibly deep and holistic. We have girls that are with us for years at a time. We're taking them through schooling. We're taking their children through schooling. We have counselors. And so that kind of a model requires that most of our staff and our team are in Kenya where we're providing the services. So to provide a little bit of a background, how the organization was originally set up is that our headquarters are in the US, and then all of our operations and our programs are in Kenya. And so we are registered in both countries. But originally, most of our executive team was sitting in the US, and our US board was also in charge of strategic decision making for the organization. I was originally on the US board. I was brought in late 2018, actually in the CEO position in the US. My background in global development, I've been kind of working in this space for a while. And one of the things that I started to do was have conversations with the board to really think about what is the best structure for the organization so that we can ensure long-term sustainability, but that we're also able to be nimble and change to make sure that we're providing the best services. So one of the first thing we pushed for was to actually put an executive position in Kenya. So Geoffrey was brought on first as interim COO and then our executive director in Nairobi just a few months after I started. I think it was about 5 to 6 months. We were lucky enough to find the right person. We were both kind of brought in so that we could do an operational and a programmatic turnaround. The organization had grown very quickly in programs, but not necessarily the operational infrastructure to handle it. And one of the first things that I kind of told the board is, look, if I'm sitting in the US and only going to Kenya once a quarter, even if I'm there for a month, there is no way I can do what we could do if we actually had an executive on the ground who's seeing the day-to-day and able to talk to the team and understand their challenges as well as the girl challenges. So that was the first step of kind of bringing an executive on the ground there. And in that, we started to have the conversations of, well, what it would look like if we actually switched it and had most of the executive positions in Kenya. Well, comes COVID and 2020. And interestingly enough, I think it is the out of the challenge that COVID provided was really what pushed both boards in Kenya and the US to be brave enough to make the transition where we switched the CEO position to Kenya. Now Geoffrey is our CEO. And a lot of that is because we had executive presence, we were one of the few organizations in kind of this global context that didn't have a problem of all of a sudden having to pull back because your executive team is stuck. I haven't been able to be in Kenya in a year and a half. If we had not had Geoffrey in place, we would not be in the position that we're in. There was no way I could have led in a crisis from far away and be able to navigate all of the changes that were happening. So we were, education was disrupted across the board globally, but especially for refugees. Businesses were closed and the impact in the informal sector was huge. Well, by having Geoffrey there, we were the first organization serving refugees that were able to go virtual in our education. And we were able to secure a $500,000 grant from MasterCard because we showed them that we were able to be nimble. And so we're working to build an e-learning and wellness platform now for urban refugees that are not able to get our kind of brick and mortar services on our campus, because what we saw was, oh, there's parts of our model that we can actually translate digitally. So we had to go virtual in 2020. It was obviously not the best situation for the girls, but because we had the right presence on the ground, we were able to make the best of it and, kind of lemonade out of lemons, and figure out how to provide more services to more women and girls when we do open up. And we got super creative. We're now we're working to safely reopen our campus. So we're kind of hybrid open right now. The Kenya ministry has asked educational institutions to open. So we're kind of back at trying to get up to capacity. And so, all of these things that happened in 2020 have led us to, we're working on deepening our mental health services. We're working with MasterCard on this e-learning and wellness platform. We were able to secure a partnership with Cisco to build out an IT lab so that we can provide additional vocational training. And we also were in 2 incubators to really look at our Artisan Collective. None of that could have happened in a crisis year if all of our executive team had been stuck in the US and not be able to get on the ground. We would still be in putting out fires. Instead, we were able to control the fire and figure out how do you use that so that we can be adaptable and flexible and innovative. And so that really led to us making the official transition. Both boards voted. And so Geoffrey is now CEO, and we have hired our CFO to be in Kenya as well. So our 2 top executive positions are now in Kenya, and we're restructuring the US to, instead of kind of be the face of the organization, which often happens, right, where the executive team is the face, but I shouldn't be the face. I'm not the one who's doing the day-to-day work. It should be our team on the ground. So we're looking at how does headquarters rethink what their role is? Instead, we should be investors and amplifiers of our local leadership teams, as well as the work that we're doing. We should be behind the scenes, really being the platform to amplify this, as opposed to the face of the organization. And one of the things that we are hoping to do is inspire other organizations to do this and have this larger conversation about what this means. And part of this is the need to actually look at the entire structure in global development. So a lot of the challenges that nonprofits face is how funding comes to us and how the donor incentive structure is created. So the donor incentive model primarily is locked in grants or individual donors. Most of it is restricted. So like we are restricted, we could get, $1 million, but the donor will say it can only be used for X, Y, and Z. Well, when you have restrictions like that, things like an organizational turnaround or a leadership transition, there's costs associated with that, right? We have to make tough decisions. We've got employees, we've got restructuring that we have to do. If we don't have capital to be able to invest in that, that's going to be a problem. And we also need the donors to trust that local leadership can do the same thing and better than leadership sitting in the US. And so that means that donors have to invest in local leadership. And it's also going to mean that you're going to get locally driven solutions, which are far more likely to succeed than a parachute in solution from the West that has nothing to do with the local context. So we are really pushing this, and this is kind of our Dear Donor letter, because until the donors shift this, it's going to be very difficult for a lot of nonprofits to do what we did because they don't have the flexibility. So again, it's the investing in local leadership and locally led solutions, awarding unrestricted grants. So removing power over grants and really trusting power. If you trust the organization to do the work, trust them to use the money in the way that needs to be done. And then the last thing is incentivizing collaboration versus competition. So most of grant awarding in the social sector is competitive based. So you'll have 6 organizations, for example, that are working in the refugee space. We've got 6 other organizations that work in the space in Nairobi. Well, we're competing for the same amount of money, but we're often serving the same girls. So we're not incentivized to work together or even share data with one another where we could learn from one another and say, hey, we tried that. It didn't work. Don't waste your time. Or we tried this. This works. Go do it. But if we're competing, we're holding our cards really close, because then we're like, oh, well, if I share that something didn't work, I'm not going to get the funding and they're going to get the funding. We should be getting paid to share data, share learnings, and to work together. So that whole model of kind of competitive bidding needs to be rethought, because as long as that's in place, then we're not actually doing what's in the best interest of the beneficiaries, which is anybody that they touch, any organization should know exactly what's going on in their lives. But if we have to kind of hold our cards and keep everything close, then they're falling through the cracks because we're not talking to one another, because we're not incentivized to. So I'm going to kind of stop there and allow for discussion, but we wanted to give a little bit about RefuSHE, but then how that played into this larger context of the leadership transition we were able to do.
Thank you so much, Jailan and Geoffrey. So we have a couple questions that have been prepared by the MPA students, both a little bit about the work of RefuSHE and then about your perspectives more broadly on the work of NGOs, nonprofits, and then philanthropy, both in the US and abroad. So the first question I have is for Jailan. So Jailan, you're a self-proclaimed social impact alchemist. Can you tell us a little bit more about what this means?
Yeah, so I kind of came up with this term talking to different colleagues. It was a few years ago. So I've played the intersection between kind of the private sector and philanthropy and community development. And so I've worked kind of on all sides of the equation. And for me, I find that we oftentimes get lost in silos, right? If you even look at the Sustainable Development Goals, it's like hunger, and then healthcare, and all of these little silos. But when you're talking about economic development and livelihoods development, there isn't one thing, right? If you're not dealing with sanitation and hunger and energy, then you're not going to uplift a family or uplift an individual. So I started to, for me, social impact alchemy is like this like, it's an alchemy of different interventions that have to happen at a certain way to really be able to move the needle forward. Otherwise, we're kind of just like running in the hamster wheel, right? Trying to do our best, putting money in, but if we're not connecting how all of this fits in a holistic place, we're kind of just, attempting to do the impossible.
That makes sense, especially with the holistic approach that RefuSHE takes that you explained today. So one of the themes for this event was decolonizing philanthropy. And so you talked about that in your introduction to the work of RefuSHE. So I wanted to touch on that a little bit more broadly. When we think about the terminology, decolonizing philanthropy, we know that the idea has received in the US more public attention after the social unrest we had here in the summertime. But this is something that the international development sector has been talking about and thinking about for a long time. Can you share your perspectives with us on what decolonizing philanthropy means from a domestic perspective within the US and then from an international perspective, and how these might differ, if at all?
Sure, I can kind of talk about domestic, and then I'll let Geoffrey talk more globally and how it plays out globally. So, I think domestically, we have to look at it through the historical lens of American history, right? So it is very much tied into the structural inequity that comes out of an American history. And so it's falling on racial lines, it's falling on economic lines, right? Globally, we need to look at it a little bit differently because every country has a different history. And so equity and social justice looks a little bit different. We've always globally talked about this as like localizing. How do we localize? And then, all of a sudden the US finally had a reckoning, and we're talking about decolonizing, and the rest of the world is like, well, I guess the US finally got it, and this is how we're going to talk about it. But it's like not new in terms of global, because this like idea of economic imperialism and extracting has always been the case. So I'll let Geoffrey kind of provide the lens from a Kenyan perspective, but globally that's different from our US history.
Yeah, thank you, Jailan. Domestically also, it's been a well-known, across the non-governmental sector, it's been very well known that, for example, if a local grassroots-led, local-led organization tries to pitch for funding, and it's competing with an organization that probably the head office is in Chicago or Denver or New York, it becomes very easy for the organization that actually is headquartered in the US to get the funding, irrespective of whether that the local-led organization has proper structures, has a track record, has impact. And usually the end point is usually that we don't seem to know you. We don't know you. So there are nuances there that, it's whispered around the NGO sector that if, for example, I really need funding as a local grassroots-led organization, I may need to get Dr. Medina to be a face within my management team, so that with her face, then I can be able to get funding much easier from donors. than if it was just purely. So there are issues, there are concerns around, racial kind of nuances that are not spoken loudly, but, they're implemented there. And that kind of hinders, the development sector from meeting its targets. And you find impactful organizations really struggling to scale up their operations. Not that they have even been proven to be, corrupt or, having failed the standards that are expected. They're not even given a chance of, to be trusted off the blocks to be able to do something productive before they're judged. Thank you.
Thank you. So the next question is kind of related to how you discuss all of these issues with your donors and funders. So how do you think funders, both from an organizational perspective as well as individual donors, can become part of the efforts to improve the delivery of human services from international nonprofits with this frame of decolonized philanthropy in mind? And one of the audience members actually added a question that's related to this. So you mentioned funding needs to be less restricted. There needs to be more trust, more collaborative, field-driven work. How is your organization leading funders in this direction?
Yeah, so I think the conversation is going to be different for different funders. So for our larger grants that tend to be government or large foundations that are working in global development, again, this idea of localization isn't new, right? It's the branding around it is now having a different conversation, but that's been talked about for years in the sector. So even when we told our donors, it was a lot easier to have the conversations with our government and our larger foundations because it wasn't a new concept, right? In fact, the State Department prefers to fund all of our local staff versus the US because they see the US as just, heavy overhead. It's not necessarily going to programs. So I think globally, the larger donors were ahead of the game than we were domestically. I think the US domestic situation was a very different story. Individuals, I think, is where it's going to be the challenge, because individuals, it is a very personal, investment. Most of them, especially globally, don't understand the implications of the work and how detailed it is. It tends to come from an altruistic place, but it's a bit of a savior mentality. So individual philanthropy is problematic in and of itself for various reasons if the person doesn't have a deep understanding, right? That's why you'll often see individuals come in and they get really excited by a great idea, like let's throw a playground here. But then, it's not the right place for a playground, or it's something that is actually going to cause more issues for the local community. So that's where the education needs to happen, because they're not experts in global development. They don't know what it's like in the field. They want a nice, warm and fuzzy marketing thing, but that also has, its own thing. So I think that the education is going to be primarily for individual donors, but again, that's in the global context. Domestically, you're finding that nonprofits are doing both, because the larger grants were not necessarily aligned.
So my next question is for Geoffrey. So Geoffrey, your role as an in-country expert and CEO came out of this need and emphasis on having local level expertise rather than outside experts managing the show on the ground so far. So as the CEO for an NGO that's also registered in the US, how do you help to navigate the complexities of working with two governments? And then for students who might want to enter this space, do you have any thoughts on the type of skills that they might need to try and navigate that area?
Right. Thank you so much, Dr. Medina. To navigate around two governments, and I have the benefit and the privilege of working with the local US. For example, we work with a local refugee representative of the US government here in Nairobi. Now, his physical presence here in Nairobi, and we have scheduled meetings, he's able to get firsthand the success stories that we are recording and the challenges that we are recording in the implementation of the program, even before waiting for the entire reporting structure. And this we have by having informal meetings that I know every 2 weeks I have a scheduled meeting with a local representative, and he's free to come and visit the campus at will. That kind of relationship has, and the trust that has been built over time has given him the confidence to know that we are doing a good job. Secondly, we also do have a lot of compliance checks. We comply, for example, with the United States government federal requirements on how to do our reports and expenses, and how to keep our books. That is audited every year. And the US auditor has to pass that we have done things accurately according to the requirements. That helps in our kind of relationship. Also, thirdly, is that we have constant communication and visits. It's just that COVID happened, and that has limited our bit of travel. But if we plan to ensure that we have constant face-to-face meetings, also with the local administration here in Kenya, and also the US counterparts, and that builds confidence and encouragement. Your second part was, what would I encourage? I would encourage organizations to take the risk and bite the bullet and give the local administration opportunities to prove themselves. And this first year of the COVID has proven that indeed, when you have a nimble organization and a very effective leadership, you can be able to pivot and be able to deliver services that otherwise would have taken long in terms of implementation, because of the bureaucracy that would be between the US and the local organization to pass even, to explain out the challenges. In the end, the people who would suffer most are the vulnerable people that you're trying to serve. Thank you.
Thank you. So to continue on the theme of managing the organization on the ground, your organization was a pioneer in altering the service delivery to maintain physical distancing as a result of the pandemic. So in light of the fact that digital services aren't always accessible or available, how have you pivoted during the pandemic to continue services? And then what are some of the challenges that you still face?
Thank you. We have a school, which is brick mortar, basically a brick mortar kind of a model of our education. We didn't have any digital format of education before COVID. So what happened is when COVID broke out and the government decided to close all schools, our teachers decided that they needed to continue having education go through to the girls. And one of the key drivers for that particular decision was that we are aware that anytime you keep a refugee girl away from school for a long extended duration, the probability of them coming back to school will be almost close to zero. The longer the period, the greater the chance either they will be forced into marriage, or they will be able to, to be sidetracked, or even get involved in dangerous sexual behavior. So for us, quickly our teachers transitioned. They started sending WhatsApp videos. They would train the girls using WhatsApp videos, Google Meet. And this was basically a fast, kind of fast aid, kind of, very rudimentary kind of training that they were getting the girls on. But we were the first organization to ensure that our girls, we provided them with cheap smartphones so that they were able to access, the education. They did not have, they don't have documentation. So we had to register all the phones in our organization name, issue the girl with a phone, train her how to use a smartphone. Some of these simple things may look very simple, but a young girl who has never handled a phone, for the first time, they were getting a phone, and that was supposed to help them, to use that phone. Then we also pivoted our case management support. Our case workers now moved that particular support from face-to-face, even to just telecalling the girls, finding out how they are. We moved our mental health counselors, our psychosocial counselors. They started also calling the girls and giving them support through, mobile phone. Even our vocational training, where the teachers also would, take videos of themselves, take videos of how they were doing cuttings for dresses and clothing and scarves, and send to the girls. And the girls would send back the finished work, or they would send back the videos of the work they had done. The small babies in the our early childhood program, the caregiver would also record themselves, with songs and vowels and sounds, and would send to the girl mothers, and would tell the girl mothers, please practice with your children, and in the evening send me back the sounds that your child has made, the learning the child. And that was very, very effective. And it was very, very exciting to ensure that the girls continued with their education. We managed to ensure that at least to a tune of about 85 to 90% of all our girls were able to get on classes on a daily basis.
Thank you. And it sounds like both the maintenance of education, but also the relationships that they had built with the counselors over time was really important. So before we move on to some questions from the audience, I have just two more for you two. So the first is, what can public administrators, so people working both at leadership levels and on the ground, do to help ensure that nonprofit programs and the services or activities that they deliver are designed in a way that is equitable? And are there any lessons that domestic nonprofits can also take from the work that you've done?
I'll start and then Jailan can finish it up. I think one of the key things is to involve the participants or the beneficiaries in the decision-making process, asking the local community about their needs and providing solutions. Many times the solutions are there, the local community know their solutions, they know what they need. And from there, looking for proper fit solutions rather than just what has been, for example, what has been done in Bolivia and worked in Bolivia may not necessarily work in Kenya for various reasons, either environmental, cultural, and it's very important to ensure that those that you are, who the services are engaged for, are involved in those decision making to be able to support through. And public administrators need to realize that it's not a one fit all for all solution. Sometimes we need to have solutions that are tailor-made to fit the particular situations and circumstances that are on the ground. Over to you, Jailan.
Thanks, Geoffrey. So I think it's an interesting question, the kind of domestic between global. So I've had a chance to work here in the US, but most of my career has been globally. And I find that globally, we are far further along from an innovations perspective. And that's because if you look at the history of how philanthropy was done domestically, so globally, most of the philanthropic dollars did come from multilateral or bilateral kind of government entities. And so it quickly had to go towards market-based solutions, right? Because the dependency model wasn't working. If you were just kind of parachuting in something, and then as soon as that organization leaves or that funding leaves, things fall apart. We started seeing that in like the 80s and 90s. So global started to do this pivot towards market-based solutions. Can the local community own this, right? Like, how do we do that? That was not happening anywhere close to the same amount domestically. And domestically, if you look at it, so most of the funding is individual donors or like small family foundations, with government funding coming from state and federal, very much tied to state policies and state politics, as opposed to like aid, because it's still it's more part of the public sector services than like social sector services, right? And so domestically, we actually see a lot more cultures of dependency being created, right? Where you have, situations where family X, in Atlanta start a group and they're going to give gifts to, families in a different part of Atlanta that are underprivileged. Well, it's a very nice thought, right? It's very sweet. But what you've ended up doing is creating a culture where now, one, kids in that community believe that white rich people are the ones who are going to come in and give them gifts. So you have taken the dignity away from their parents. And then two, instead of actually figuring out how do we create jobs in that community, you've created a dependency cycle. So I have found it far more kind of wanting to bang my head up against a wall, frankly, domestically, in these like deep cultures of dependency we have created here in the US, as opposed to how do we take market-based strategies to actually bring economic empowerment to communities and job creation so that communities can take care of their own. And I think we're actually way, way further behind than what we see globally.
I can chime in something, Jailan, and this conversation is very important because also on domestically, when we are serving like the beneficiaries, we are trying to create a sense of independence, rather than dependency. And that has been a big problem because many solutions that are coming is to give freebies. And when you give freebies to people, and especially like to the young girls that we serve, then after 4 or 5 years, when they've been in our program, they find themselves incapable of even standing on their 2 feet. So one of the big things that, like, for example, that I'm passionate about is how do I take a very, vulnerable girl when she's joining our programming and develop the resilience in her to be able to make personal, strong decisions. For example, global resettlement rates have been declining over time. And over the last 5-10 years, we've seen a huge drop of resettlement, meaning that refugees will remain in the host country on an average of 16 years. Therefore, there is need to build resilience in them rather than give them sometimes what is given as freebies. So for us is how do we continue having this discussion to pivot even how the solutions that we are offering to even the beneficiaries. Thank you.
Thank you both. So I'm going to move on to a couple questions from the audience for you. So the first one is, how did you approach the board about the headquarters shift? And what advice would you give to other organizations who are just beginning this process and may struggle to get their stakeholders on board?
Yeah. So it's interesting. I started on the US board, and when we were starting to look at the CEO position here, I actually stepped in as a consultant to do a mini assessment of the organization. So went to Kenya, did a mini assessment, and came back and said, look, where we actually are is we need someone who can do a turnaround. Long story short, I was not going to throw my hat in the ring. And then after a lot of conversations, it came to that. And so I upfront told the board I would only do this if we all agreed it would be 2 to 3 year turnaround, and then I would step off. So I am working my way out. Because if I didn't have that, there is no way that I could do a structure that doesn't biasly protect me, right? If I'm in it to protect my own job, then it's not going to work. So I said, before we go in, we're all going to agree on this. And the other thing I had the board agreed is you have to be completely open, every single one of us, that things could look very different at the end of those 2 to 3 years. That could mean localizing. It could mean a merger and acquisition with another organization. We looked at that as well as potential structures. What would it mean to join another organization, same size? And then that way you're like, US headquarters are less of a drain, a larger organization. So up front, it was a discussion with the board that I wasn't even ready to step into this unless we were all on board that things would look very different, and we put a timeline around how to make this happen.
That's bold and committed, Jailan. And something that, maybe other people wouldn't be willing to do. So that's a lot of leadership on your part. So any other questions from the audience, please make sure to send them through. We only have a couple more minutes, but while we're waiting, I'll ask you one of my last ones. So let's link back with some of the potential action items for those listening in, specific to the mission of improving the lives of refugees. So what are some ways that public administrators and even just the general public can do to help address the needs of refugees, both the ones living in the US and our communities, as well as abroad?
Geoffrey, do you want to start with integration, and then we can maybe share with them the 3 durable solutions?
Yeah, thank you. I think it's important that countries that have signed up on the UN conventions on the rights of refugees, continue to comply. I know sometimes it's a very fearful thing when you see your borders being overrun by people fleeing from far countries to come into your nation, either for economic reasons or for other reasons. And it's usually scary because governments don't know. And the general feeling is that refugees are a drain to the national resources. One, I think it's important to realize that refugees have the rights like any human being, access to education, access to equal opportunities, access to employment, that they can be able to provide, they can be able to provide support to the local economy, and they can be productive people and can support the economy. So it's important to start having that conversation of how do we harness this particular resource in a way that is sustainable for the host country, and also sustainable for the refugees. Secondly, it's important to also look at local solutions in the countries where the refugees are coming from. And is there anything we can do either internationally to support proper structures that will keep refugees, rather than all of them wanting to come into the United States of America? Is there solutions that we can do locally to keep them and provide for them opportunities in the host countries? Many of them are looking for a better life. And if you are able to provide that in their host country, support structures or governments or, in those organizations like ourselves, RefuSHE, to be able to give these refugees durable solutions in the host countries, then that goes a long way in elevating the problems that we see. Over to you, Jailan.
Thanks. I think Geoffrey really kind of nailed all three. So if you're a refugee, there's basically what's called 3 durable solutions. One is repatriation, going back to your home country, often not an option. 2 is local integration, either in your host country, in the host country, and a host country is that first country that a refugee escapes to for safety, and then puts themselves into the UN system and applies to have refugee status where they're safe. So that's a Kenya, a Mexico, a Jordan. And then 3 is getting resettled formally through the UN system to a third country, which right now are typically is somewhere in Europe, the US, or Canada. Well, if the countries that are typically resettlement countries like US, Canada, Australia aren't taking refugees, that then pushes the burden even more to host countries like Jordan, Mexico, and Kenya. And so then that pushes their citizens to be like, well, now we're taking on the full burden, right? So we're creating this situation where it's going to potentially lead to a situation where there's conflict that'll lead to even more refugees, as opposed to what Geoffrey's talking about, seeing the opportunity and integrated refugees so that you minimize conflict, which is the thing that got us in the problem to begin with, right? So local integration really is key, as Geoffrey was saying.
Thank you both. And just to add a little bit to that, I mean, I think we're, happy to see within the US that the new administration will be raising the historically low caps that we had on refugee admissions over the last few years, and hopefully refund a lot of the refugee resettlement programs here that have seen their funding decline as a result of those policies. So thank you so much both for sharing and for meeting with us today. I think we're close to out of time, so I'm going to let Ariana wrap us up now.
Well, yeah, just to echo Dr. Medina, thank you all for tuning in. And thank you to our panelists, Jailan and Geoffrey, who actually are my bosses. I didn't mention this when we kicked off our event, but it's always a joy to hear them present as an attendee myself. So I included in the chat my RefuSHE email address as well as our website. So if you have any further questions or would like to learn more, I encourage you to please reach out. And thank you so much, Dr. Medina, for leading such a thoughtful conversation. So appreciate everyone for tuning in, and I hope you have a great rest of your day. Bye.
Thank you, everyone.